51. A systematic psychiatric interview gathers broad information that helps you to A. Assess the patient's psychological functioning. B. Formulate the care plan. C. Identify the underlying or precipitating cause of his problem. D. All of the above. The correct answer is D. All of the above. 52. All of the following are guidelines that can be followed when conducting the patient interview, except A. Ensuring privacy. B. Using reliable information sources. C. Making assumptions. D. Showing support and sensitivity. The correct answer is C. Making assumptions. 53. Assessing blank will help gain insight into the patient's environmental development. A. Psychiatric history. B. Psychosocial history. C. Family history. D. Medical history. The correct answer is C. Family history. 54. Assessing the patient's blank will help you evaluate mental and social status function. A. Family history. B. Medical history. C. Psychiatric history. D. None of the above. The correct answer is D. None of the above. 55. Reviewing patient's medical history helps the nurse to know which of the following details: patient's list of medications. B. Patient's religious practices. C. Patient's sleeping patterns. D. All of the above. The correct answer is A. Patient's list of medications. 56. The nurse must observe the patient's blank. A. Behavior. B. Gestures. C. Mannerism. D. All of the above. The correct answer is D. All of the above. 57. Which of the following is referred to as a pervasive feeling or state of mind? A. Activity level. B. Mood. C. Attitude. D. Behavior. The correct answer is B. Mood. 58. Which of the following is known as variation in affect? A. Feelings. B. Mood. C. Range of emotions. D. Affect. The correct answer is C. Range of emotions. 59. The following are indications of mood disorder except A. Flat affect. B. Lability affect. C. Situational affect. D. Inappropriate affect. The correct answer is C. Situational affect. 60. Blank is an unresponsive range of emotion which may signify Parkinson's diseases. A. Flat affect. B. Situational affect. C. Unresponsive affect. D. None of the above. The correct answer is A. Flat affect. 61. Blank is known as a rapid and dramatic fluctuation in the range of emotions. A. Dramatic affect. B. Lability affect. C. Fluctuating affect. D. Flat affect. The correct answer is B. Lability affect. 62. Asking a patient to repeat the same word after 5 to 10 minutes is known as A. Improved recall. B. Immediate recall. C. Delayed recall. D. Assessed recall. The correct answer is C. Delayed recall. 63. Blank is referred to as the interpretation of reality as well as the use of the senses. A. Insight. B. Judgment. C. Perception. D. Comprehension. The correct answer is C. Perception. 64. Proponents of the cognitive theory have proposed that depression arises from blank. A. Perceived loss. B. Distorted perceptions. C. Unresolved conflicts. D. All of the above. The correct answer is B, distorted perceptions. 65. An experience where patients perceive non-existent external stimuli is known as blank. A, hallucination. B, illusion. C, depression. D, none of the above. The correct answer is A, hallucination. 66. An experience where patients misinterpret external stimuli is known as blank. A, schizophrenia. B, hallucination. C, illusion. D, acute organic mental syndrome. The correct answer is C, illusion. 67. Which of the following is associated with hallucination? A, illusion. B, acute organic mental syndrome. C, depression. D, bipolar disorder. The correct answer is B, acute organic mental syndrome. The following disorders indicates organic disorders except A, tactile hallucinations. B, olfactory hallucinations. C, gustatory hallucinations. D, auditory hallucinations. The correct answer is D, auditory hallucinations. 69. Blank are false beliefs with no firm basis in reality. A, delusions. B, illusions. C, mental syndrome. D, hallucinations. The correct answer is A, delusions. 70. Only a blank can declare a person incompetent. A licensed practitioner. B, a judge. C, a doctor. D, none of the above. The correct answer is B, a judge. 71. Blank is a behavior that operates on an unconscious level to protect the ego and reduce stress. A, self-destructive behavior. B, defense mechanism. C, incompetent behavior. D, compulsive behavior. The correct answer is B, defense mechanism. 72. Which of the following is an example of self-destructive behaviors? A, denial. B, regression. C, projection. D, mutilate body parts. The correct answer is D, mutilate body parts. 73. Repeating certain actions to ward off anxiety without weighing the possible consequences of those actions is known as blank. A, rationalization. B, denial. C, acting out. D, withdrawal. The correct answer is C, acting out. 74. Blank refers to the creation of unrealistic or improbable ways of escaping from daily pressures and responsibilities. A, undoing. B, sublimation. C, fantasy. D, reaction formation. The correct answer is C, fantasy. 75. Which of the following is an indication of suicidal ideation? A, withdrawal from others. B, putting affairs in order. C, saying farewell to family and friends. D, all of the above. The correct answer is D, all of the above. 76. All of the following are safety precautions to be taken if you believe the patient has a high risk for suicide, except A, plan for observation of the patient. B, clarify day staff and night staff. C, keep the patient's suicidal thoughts confidential. D, provide a safe environment. The correct answer is C, keep the patient's suicidal thoughts confidential. 77. Which of the following is an example of a personality and projective test? A, Beck Depression Inventory. B, Draw a Person Test. C, Minnesota Multiphasic Personality Inventory. D, all of the above. The correct answer is D, all of the above. 78. Cognitive assessment scale measure which of the following? A, orientation. B, cocaine use. C, neurologic function. D. None of the above. The correct answer is A. Orientation. 79. Beck depression helps diagnose blank and determine its severity. A. Hallucination. B. Depression. C. Illusion. D. Compulsion. The correct answer is B. Depression. 80. Blank tests help assess personality traits and ego functions in adolescence. A. Minnesota Multiphasic Personality Inventory. B. Draw a Person Test. C. Thematic Test. D. Sentence Correction Test. The correct answer is A. Minnesota Multiphasic Personality Inventory. 81. In a blank test, the patient is shown a series of pictures depicting ambiguous situations and asked to tell a story describing each picture. A. Draw a Person Test. B. Minnesota Multiphasic Personality Inventory. C. Thematic Apperception Test. D. Pictorial Test. The correct answer is C. Thematic Apperception Test. 82. Effective planning must include all of the following except A. Focus on specific client need. B. Consider patient's strength and weakness. C. Include feasible intervention. D. Choose appropriate nursing diagnoses. The correct answer is D. Choose appropriate nursing diagnoses. 83. Goals set for each applicable nursing diagnosis must blank. A. Relate directly to the nursing diagnosis. B. Reflects the desires of the patient and his family. B. Be measurable and realistic. D. All of the above. The correct answer is D. All of the above. 84. Antipsychotics are example of which therapy used in the treatment of psychiatric patients? A. Psychotherapy. B. Behavior therapy. C. Drug therapy. D. Electroconvulsive therapy. The correct answer is C. Drug therapy. 85. All of the following are types of counseling except A. Drug therapy. B. Psychotherapy. C. Electroconvulsive therapy. D. Behavior therapy. The correct answer is A. Drug therapy. 86. The goal of blank therapy is to identify and change the patient's negative generalizations and expectations. A. Individual therapy. B. Family therapy. C. Cognitive therapy. D. Group therapy. The correct answer is C. Cognitive therapy. 87. Blank uses the patient's environment as a tool for overcoming disorders. A. Cognitive therapy. B. Environmental therapy. C. Social therapy. D. Milieu therapy. The correct answer is D. Milieu therapy. 88. Which of the following is not a type of psychotherapy? A. Crisis intervention. B. Positive conditioning. C. Group therapy. D. Family therapy. The correct answer is B. Positive conditioning. 89. Blank is also called flooding. A. Implosion therapy. B. Aversion therapy. C. Milieu therapy. D. All of the above. The correct answer is A. Implosion therapy. 90. Blank provides safe alternative to self-withdrawal after prolonged dependence on alcohol and drugs. A. Response prevention. B. Detoxification. C. Avoidance therapy. D. Desensitization. The correct answer is B. Detoxification. 91. The most controversial treatment in psychiatry is the blank. A. Milieu therapy. B. Assertiveness training. C. Electroconvulsive therapy. D. Thought switching. The correct answer is C. Electroconvulsive therapy. 92. During ECT, electroconvulsive therapy treatment, a tiny electric current is applied to the brain for blank seconds. A. 1 second or less. B. 2 seconds or less. C. 3 seconds or less. D. 4 seconds or less. The correct answer is A. 1 second or less. 93. A typical course of ECT, electroconvulsive therapy treatment, involves a total of blank to blank ECT treatments. A. 4 to 10. B. 5 to 11. C. 6 to 12. D. 7 to 13. The correct answer is C. 6 to 12. 94. Blank provides nursing care to patients in inpatient settings. A. Clinical specialist. B. Advanced practice nurse. C. Psychologist. D. Nurse generalist. The correct answer is D. Nurse generalist. 95. The Mental Health Systems Act specifies which of the following? A. Treatment must be given by an adequate staff. B. Treatment must be given in the least restrictive settings. C. Treatment must be given according to individual treatment plan. D. All of the above. The correct answer is D. All of the above. 96. Obtaining informed consent is the responsibility of the blank. A. Family. B. Patient. C. Admitting provider. D. Court. The correct answer is C. Admitting provider. 97. The blank states that the patient has the right to expect that all communications and records pertaining to his care are kept confidential. A. ANA Code of Ethics. B. American Hospital Association's Patient Bill of Rights. C. Mental Health System Act. D. Mental Health Patients Bill. The correct answer is B. American Hospital Association's Patient Bill of Rights. 98. The law requires disclosure of confidential information under which of the following circumstances? A. Suspected child abuse. B. Legal guardian requirement. C. Necessary academic requirement. D. All of the above. The correct answer is A. Suspected child abuse. 99. Mentally ill patients have right to which of the following? A. Marriage. B. Have children. C. Use contraception. D. All of the above. The correct answer is D. All of the above. 100. Restraining should not be used as A. Punishment. B. Staff convenience. C. Substitute for treatment. D. All of the above. The correct answer is D. All of the above.